If your hair is thinning, PRP therapy is one option dermatologists often discuss for supporting weakened follicles. PRP stands for platelet-rich plasma. It uses a small sample of your own blood, processed to concentrate healing components. Platelets carry growth factors. When injected into the scalp, they encourage blood flow and support hair follicles that are still alive. PRP is not a hair transplant. It does not add new follicles. It works on the ones you still have. Dermatologists most often consider PRP for early to moderate pattern hair loss, where miniaturized hairs show follicles are still active. A session begins with a small blood draw from your arm, just like a routine blood test. The blood is spun in a centrifuge for about 10 to 15 minutes to separate and concentrate the platelets. The dermatologist then injects the concentrated plasma into the scalp in a grid pattern, using a fine needle across thinning areas. A session takes about 45 to 60 minutes. Numbing cream or cold air devices help reduce discomfort. Downtime is minimal. The scalp may feel tender, with some redness or mild swelling for a day or two. A typical course is 3 to 4 sessions, 4 to 6 weeks apart, followed by maintenance every few months. Most people notice less shedding within 2 to 3 months. Visible thickness usually appears between 4 and 6 months. PRP is often combined with minoxidil, finasteride, or a hair transplant. It supports follicles but does not stop genetic hair loss. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.